The number and size of tumors in other parts of the body, which had spread from the main tumor via the bloodstream, were reduced in the animals treated with 3 milliamperes of positive current, but not in those treated with a negative current. However, a similar finding was noted with both the positive and negative treatments using the smallest level of current. Consistency would require that some similar effect would have been noted at the current levels between these highest and lowest currents. However, this was not the case. At this time, the best conclusion that can be drawn from this experiment is that the tumor destruction was the result of local electrolysis at the needle electrode. The observations of the metastasis are interesting but difficult to evaluate. The metastasis were not directly exposed to the electrical currents, and we must therefore assume that effects on them were due to effects on the primary tumor. Tumor necrosis factor was not known at the time, but it appears conceivable that it might have been produced by necrosis of the primary tumor. Nothing more was heard of this type of study until recently when Professor Bjorn Nordenström, a radiologist at the Karolinska Institute in Sweden, published this book postulating biologically closed circuits. Nordenström became interested in bioelectricity when he observed the structure of lung tumors on X-rays. The radiating lines extended out from such tumors, reminding him of the electrical corona, and he began an investigation of many years' duration into the movements of electrical currents in the body. It was not possible to review here the entirety of Nordenström's work, which covers a large area of bioelectricity. In essence, his basic concept of closed electrical circuits is complex, but appears to have little support biologically or in the scientific literature. Nordenström's cancer treatment methods differed little from those of Apostoli, Martin, or Schabel and Hobel. Nordenström inserts stainless steel needles electrodes directly into lung tumors under X-ray visualization and applies 10 volts of positive electricity. With a negative electrode applied to the skin of the chest, many of his published X-rays show a gas bubble, indicating electrolysis and general tissue destruction. The reports of all of these researchers share the same defects due to the lack of attention to basic principles of physics and electrochemistry. They are derived from the information that rapidly growing tissue are electronegative and from the simple concept that positive electricity should in some magical way cause a cessation of tumor growth. In Nordenström's case, the theoretical construct was different, but the final approach was the same. However, we now know that the idea that positive electrical current inhibits cancer cell growth is incorrect. Cancer cells respond to both positive and negative electricity by growing rapidly. The degeneration of the tumors observed by Humphrey and Seal can be attributed to the fact that the current in the vicinity of a positive metallic electrode is carried by ions given off from the electrode itself. Ions of copper, zinc, and stainless steel, which is actually an alloy of many different metals, including cobalt, are toxic to all cells, and cancer cells are no exception. In the higher current levels used by Apostoli, Martin, and Schabel, and Hobel, and Nordenström, electrolysis and gas formation occurs within the tumor. The result is a massive shift in the local acid-base balance, with the production of a highly acidic area with which cells are destroyed. In neither case is the destruction of the tumor the result of electrical factors acting alone or via some influence from an electrical control system. Despite these theoretical objections, the tumors are destroyed. If this is what we really want, why shouldn't these techniques be used? The reason is that apart from the local toxicity, there is a very real hazard of stimulating other cancer growth with the use of this electricity. As the current flows, it spreads out and flows along a return path to the negative electrode. In doing so, its strength or concentration per unit volume drops below the level of electrolysis. In this way, a large volume of tissue is exposed to electrical currents that stimulate rather than retard tumor growth. In practicality, treatment of a single large tumor nodule will result in destruction of the center of the cancerous mass by electrolysis. But as the current spreads through the rest of the tumor, it will be below electrolysis levels and will cause growth stimulation of the outer portions of the cancer molecule. Also, if there are several cancer nodules present in the area, treatment of one may result in its necrosis. But as occurred in several of Nordenstrom's case, the spread of the current on its return path will stimulate the growth of adjacent tumors. Nordenstrom was unable to explain this effect. Although modern studies on the relationship between simple electrical currents and cancer give us a little hope for any effective therapy. Dr. Allison's early observation remains unexplained. It seems that we are missing something. The answer appears to lie in the more sophisticated approach. Magnetic field therapy for cancer. The use of magnetic fields to treat cancer has a long and shady history involving outright fraud, along with the few serious attempts to evaluate the effect of such forces upon malignant growths. In early years of this electricity, when science excluded the possibility effect of electromagnetism on living things, this area of scientific research was apparently finally discredited. Now, with the new data of the biological nature of cancer and the relationship between magnetic fields and living organisms, we can no longer be so sure. And early in the 1960s, as my own work was progressing, I was contracted by Dr. Kenneth McLean on an MD practicing obstetrics and gynecology in New York City. Some years before, McLean had visited a mine in North Canada, where he had been told that there had been no cancer among the miners for several generations. The miners attributed this phenomenon to the very strong steady state or DC magnetic field of the mine. This gave McLean an idea, and he convinced some of his friends in the industry to loan him some very powerful industrial electromagnets. After conducting animal experiments using these electromagnets, he claimed that rats inoculated with cancer cells survived if they were treated with extremely high-strength DC magnetic fields. In the late 1950s, he began using the technique on human patients. Dr. McLean was much more of a clinician than a researcher. Being more interested in his clinical results, he often failed to set up well-controlled experiments or even to collect the appropriate data. In some cases, he obtained results that were truly extraordinary, yet the placebo effect could not be excluded. Unfortunately, the past history of magnetotherapy and present dogmatic attitude have, as of yet, prevented any scientific evaluation of McLean's ideas. We simply do not know whether he was correct. In the past few years, pulsed magnetic field treatment for bone non-unions also has been reported to slow the growth of animal tumors, with significant prolongation of survival time. This would appear to contradict those reports that pulsed magnetic fields produced marked enhancement of tumor cell growth in culture. Was there perhaps some difference in response when the tumor cells were in vivo? That is, with the living organism? The answer is no. The difference is in the way the experiment is done. In the culture studies, only the cancer cells were exposed to the pulsed magnetic field. In the animal experiments, the total animal was exposed to the pulsed magnetic field. Thus, there would be effects not only on the cancer cells in the animal, but also on the animal's organs and systems that responded to the magnetic field. As we shall see in the next chapter, time-varying or pulsed magnetic fields have a major effect on the stress response system. Exposure of the whole animal for a short time causes a rapid stress response. With a marked increase in the activity of the immune system, therefore, total body exposure, while stimulating the implanted cancer cells to grow faster, also enhances the action of the immune system. For a time, the immune system has the upper hand and tumor growth is inhibited. However, continuing the exposure beyond the short-term results in a decline of the stress response and the immune system to below normal levels. Tumor cell growth is then enhanced by both the drop in immune system efficiency and the direct action of the pulse magnetic field on the cancer cells themselves. Application of the PEMF technique to cancer treatment in humans would not, for technical reasons, entail total body exposure. The pulse field would be directed against the tumor itself, in which case a growth stimulating effect on the cancer cells would occur. None of the above should be taken as an indication that electrical or electromagnetic therapy for cancer is impossible. What it does indicate is that our current simplistic approaches are doomed to failure. As more is learned about the basic mechanisms responsible for bioeffects of such fields or currents, it is quite probable that more sophisticated approaches will be developed. Some of the possible approaches will be discussed in Chapter 10. Electrochemical growth stimulation. In the early 1970s, I began a study of the biological effects of different kinds of metallic electrodes. I have already mentioned that the current in the vicinity of a positive metal electrode is carried by means of ions of the metal itself. These ions are themselves positive because they lack one or two electrons. The positive voltage of the electrode repels the positive ions, and they are pushed or driven into the tissues. The result is a unique situation with a voltage field containing a large numbers of positive metal ions that can chemically react with membranes of living cells. It seems to me that the combination of the electrical voltage field and the reactive metal ions might produce unique cellular effects. We tested the effects of a variety of metallic electrodes on several different types of bacteria in culture. Each metal was tested at voltages ranging from a small to just above the electrolysis level. We found that above the electrolysis level, positive metal electrodes and anodes killed all bacteria, but they would have also killed any human cells. Only the silver anode killed all bacteria at voltages that would be harmless to human cells. That we had actually done was rediscover the fact that silver killed bacteria, which had been known for centuries. However, previous clinical applications had consisted of applying very thin metallic silver foil or chemical silver compounds to infected tissues. Silver foil was very inefficient because it gave off only a few reactive silver ions, which did not penetrate the tissues. Silver compounds were damaging to human tissues through the action of the anions. When antibiotics were discovered, clinicians' uses for silver as an antibiotic were discarded. 30 years after the discovery of antibiotics, many bacteria had become resistant to their action, and the clinical characteristics of infected wounds had changed. In my field of orthopedic surgery, local infection of the bone, osteomyelitis, had changed from an infection with one kind of bacteria to an infection with 4 or more different types of bacteria. This had made the condition much more difficult to treat with antibiotics. It occurred to me that the electrically generated silver ion technique, which is equally effective against all types of bacteria, might prove useful in such cases. I began using this treatment in the worst cases of osteomyelitis. These cases involved patients who not only had large open wounds with exposed infected bone, but also had unhealed fractures of the same bone in the infected side. Often such cases end with amputation, so the new treatment seemed to offer patients their last hope. There was, however, a complication. In order to stimulate bone healing, negative electricity had to be applied to the non-union. The scientific data indicated that the application of positive electrical current would not only fail to stimulate bone growth, but would dissolve more bone as well. Therefore, before the silver treatment was started, each patient was told that all it could possibly do was kill the infection and let the soft tissues and skin heal. Later, I would use the right kind of electricity, a negative electrode inserted into the non-union site to make the bone heal. In each case, the non-unions healed even faster than they would have if negative electrical currents had been used. In addition, the soft tissues and skin healed at the same extraordinary rate. The electrically generated silver ion was doing something more than killing the bacteria. It was also causing a major growth stimulation of tissues in the wound. When we finally tracked down exactly what was happening, we found that as human fibroblast cells, which are common throughout the body, were exposed to the electrically generated silver ions, they dedifferentiated. They were then able to multiply at a great rate, producing large numbers of primitive embryonic cells in the wound, even in patients over 50 years of age. These uncommitted cells were then able to differentiate into whatever cell types were needed to heal the wound. So what we were in fact doing was turning on regeneration in human tissues, which I had thought we would never be able to do. In our previous studies of regeneration, we had found that in human beings, only bone marrow cells could differentiate. Because there were so few such cells, we thought that any regeneration in human beings other than fracture healing was impossible. The dedifferentiation of the abundant fibroblast cells by electrically generated silver ions may provide us with the means to restore regeneration to human patients. While I was excited at this serendipitous discovery, my patients could have cared less how the wounds were healed. They were simply delighted at the fact that at long last a treatment had worked. Perhaps the most important moral in this story is that it demonstrates that no one can tell in advance what will happen in a scientific experiment. Electrochemical therapy for cancer. Actually, this circuitous pathway led us back to one of our original aims, the control of cancer growth. If the electrically generated silver ion dedifferentiated normal human fibroblast cells, would it also dedifferentiate human cancer cells? If so, we would have a way to duplicate it in human beings. Dr. S. Merrill Rose experiments with salamander cancers in which dedifferentiate cancer cells redifferentiated as normal cells. A lack of funds unfortunately prevented us from completing this work. However, we did find that human cancer cells in cultures appeared to dedifferentiate when exposed to these silver ions. I also had a patient with a severe chronic bone infection who had an associated cancer in the wound. He refused amputation, which would have been the treatment of choice, and instead that I treat his infection with the silver technique. After 3 months, the infection was under control and the cancer cells in the wound appeared to have changed back to normal. When I last heard from him 8 years after the treatment, he was still fine. It's important to realize that this is not simply an electrical effect, but the result of the combined action of the electrical voltage and the electrically generated silver ions. It is an electrochemical treatment. While we do not have firm evidence at this time, what probably happens is that the silver ion is shaped so as to connect with some receptor group on the surface of the cancer cell membrane. After that connection is made, an electrical charge transfer sends a signal to the nucleus of the cancer cell that activates the primitive type genes, and the cell dedifferentiates. In that state, it awaits instructions as to what is to become. The process is exactly the same as that in the Rose experiments, except that in this case, the dedifferentiation is caused by the unexpected action of the positive silver ions. This technique obviously requires more study before any clinical use can be made of its anti-tumor effect. However, it does appear to be a promising lead in another otherwise rather grim picture. Microwaves and cancer. Anyone who owns a microwave oven knows that microwaves can cook tissue, but be it a steak or a living animal, because cancerous tissues seem to be slightly more susceptible to heat damage than normal tissues. Heat has long been used as a treatment for cancer. Some evidence for this came from the misinterpretation of Coley's work described in Chapter 2, assuming that the high fever selectively damaged the cancers. The problem is that how to heat a cancer deep within the body without heating everything else as well. Microwave technology seemed to provide that answer with little engineering. It should be possible to produce narrow microwave beams whose heating effect could be localized. Through the use of two such beams, each slightly below the heating produced level, that intersected at the tumor site, it would be possible to heat only the tumor. This idea was vigorously pursued and the problems were uncovered almost immediately. Narrow beams of microwaves were not readily attainable. Also, the heat effect depended on a number of factors, including the amount of blood flow and the type of tissue exposed. Fatty tissue, for example, absorbed the energy better than other tissues. As a result, both the area and the exact amount of heating were not only easily controllable. Now, some 20 years later, many frequencies and techniques are being utilized. Some even go as far to involve the surgical implantation of small microwave antenna around the tumor, a procedure that seems rather redundant. If one is already in the body surgically, why not remove the tumor rather than continuing to apply high technology? The technique has not gained wide acceptance in the clinical world, but this is just as well. As we shall see in Chapter 8, even at very low power, microwave energy introduced into the body has a number of extremely undesirable effects. Even if we succeeded in cooking the tumor, little useful purpose would have been served if the patient then developed other cancers as a result of microwave exposure. The episode illustrates that the binding effect that high technology can have on the biomedical profession. If a technology is attractive and appears to be able to do something potentially useful, it is avidly studied and developed. But too often, no one will think to determine what the exact mechanism of action is, or worse yet, whether the technique has any harmful side effects. High voltage therapy for snakebite. This fascinating treatment method comes from the Amazon jungles, where it was developed by unschooled natives who didn't know it can be done. The technique is this: as soon as possible after a snake bite has occurred, the spark plug wire from an outboard motor is disconnected from the plug and held against the bite. While the starter rope is given a few pulls, anyone who has been unfortunate enough to have his hand on the spark plug lead while the starter rope is pulled knows that there's a lot of volts in it, about 20,000, but there is very little current. Applied to the snake bite, this voltage not only makes the victim uncomfortable, but also seems to inactivate the toxin. The success rate of this low-tech technique is amazingly high. With what would have been once a fatal bite, now apparently is survivable. Since the initial publication of this finding, professional interest seems to have died out. Exactly what happens to the toxin is unknown. Most such toxins are fairly complex biological molecules. One could postulate that in response to the high voltage pulse, a molecular rearrangement occurs that inactivates the toxin. However, this has yet to be proved. If this should turn out to be the mechanism involved, it raises an important question about the effect of such fields upon other biological molecules, including those that are a normal part of living cellular tissues. The laboratory technique currently in use seems to be somewhat related. This is an electroporation technique in which a similar short pulse of high voltages is used to cause two adjacent cells to fuse into one. It can be applied when the two cells are quite different species, producing a kind of cellular chimera. The useful aspects of two cells are combined into one cell, albeit a highly abnormal one. This technique has considerable popularity now. It is used to combine cells that produce useful chemicals but that don't grow well in culture, with cancer cells that grow extremely well in cancer. The end result of the union is a hybrid that grows quickly in culture and produces a useful chemical. Nuclear magnetic resonance imaging, the biological effects. The use of magnetic resonance imaging to look inside the body in the same way as done with the CAT scanner has become a popular diagnostic technique. Hospital administrators often feel that if they don't have the piece of equipment, they are not up to date to compete for patients. Because MRI devices are very costly. Once they are acquired, there is a pressure for hospitals to use them to pay back the initial cost. The result is a tendency to order MRI in a wide variety of cases. My observation is that MRI is most often used not to confirm a diagnosis or to look at a specific type of lesion following a thorough physical exam, but rather as a screening test. Frequent justifications for such overusage are that some things may turn up, and that MRI is a harmless procedure with no biological effects. In reality, in an MRI scan, the patient is subject to a very strong DC steady magnetic field, combined with other fields that are oscillating at radio frequencies. While no one has shown specific harm to patients, there are sufficient data in the research literature to indicate that biological effects do occur with these fields. At this time, I do not believe that anyone can give MRI an unequivocally clean bill of health. This does not mean that it should never be used. On the contrary, it is by far the best way to visualize the brain and spinal cord. It can also produce remarkable visualizations of deep-seated tumors in the abdomen. Again, it comes down to a risk-benefit question. If good medical practice is followed and a tentative diagnosis is made or a reasonable localization of a pathology is obtained, then the use of the MRI techniques is well worth the risk. However, the risk involved in its use as an unforeseen, unfocused screening technique does not appear to be justified. High energy techniques, where we are today. High energy techniques appear to be based on the idea that if a little is good, more is better. When one is dealing with subtle electrical control systems, this concept is at best invalid and at worst outright dangerous. Despite its high-tech trappings, modern medicine seems to have progressed little from the days of Galen. Simplistic solutions to oversimplified problems are still preferred to real complexities of life. This attitude has resulted in a marked release in the use of high energy techniques that are often believed to be truly effective and at the same time completely safe. For example, TENS units and their clones are being used in the treatment of headache, toothache, muscle aches, and pains due to sports or exercise, post-surgical pain, the pain of heart attacks and angina, and depression, as well as in the dental surgery and obstetrical deliveries. The use of electrical loss, body shaping, cellulite removal, bust development, wrinkle removal, non-surgical facelifts, and muscle development. Recently, the FDA issued a warning about the stimulator device, stating that no evidence exists for their efficacy in the above conditions, that they should never be used on patients with cancer, epilepsy, heart disease, or other serious conditions, and that they might be produced miscarriages among pregnant women. The discoveries of the new scientific revolution have provided not only a basis for a reevaluation of previously discredited medical techniques, but also an opportunity for outright frauds and quacks, as well as well-intentioned but misguided practitioners to acquire a veneer of respectability. Present scientific knowledge provides no basis for such beliefs as the ethereal body, the chakras, and the mystical life force, or the operations of life forces that negate the present laws of physics. Any practitioner of energy medicine who postulates that he or she has access to mystical forces or treatments that will free your body energy should be avoided. We have seen how the latest scientific revolution has validated the ancient pre-literate concept of life energy, not as some mystical unknowable force, but as a measurable electromagnetic forces that act within the body as organized control systems. The electromagnetic forces appear capable of being assessed through some of the techniques of the shaman healers, as well as through modern direct intervention with similar forces. These ideas have led to the development of the new medical paradigm, energy medicine, which is currently being slowly integrated into the orthodox scientific medicine. We have also seen how these control systems relate certain basic functions of living organisms to the electromagnetic environment. In the remainder of this book, we will explore this little understood but vitally important link. We will see how variations in the Earth's natural electromagnetic field may have played a role in the origin and evolution of life, and how our unwise use of electromagnetic energy has produced environmental changes of unparalleled proportions, with grave consequences for health and well-being of all living things.